Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello viewers, I Dr. Shikha welcome you all to THIP Media's show Health Files. Today, we'll be discussing about the disease pneumonia. According to research, 2.5 million people died from pneumonia in the year 2019. Even though child mortalities have reduced as compared to the previous years, it is still a leading cause for death amongst children under 5 years of age. In India too, the impact of the disease had not been less. In the year 2020, the incidence was around 650 cases per 1,000 children. Therefore, it is crucial to gather knowledge about pneumonia. The disease has already taken a lot of lives, and we must educate ourselves about it. So, to discuss about pneumonia, we have with us Dr. Sudeep Chaudhary. Dr. Sudeep is a well-known senior consultant in the Pediatrics and Neonates Department at Manipal Hospitals, Gurugram. So, let's get going without further ado. Hello, Dr. Sudeep. Welcome to THIP Media's show, Health Files. My first question to you is, what is pneumonia?
Right. Thanks for the question. So, pneumonia is an infection of the lungs, to be very clear. So, basically, pneumonia is an infection which is caused by certain microorganisms, which can be either viruses, bacteria, or even fungi, which affects the lungs of children and young adults, or even adults, actually. So, here we are going to discuss about children and young adults. Pneumonia is basically an infection of the lungs caused by microorganisms like viruses, bacteria, or fungi.
So, my second question to you is, what are the causes of pneumonia?
As I said, pneumonia is an infection caused by microorganisms. So there are certain bacteria like Streptococcus pneumoniae is one of the most common bacteria. Then there are certain like Mycoplasma pneumoniae, group B streptococci, Staph aureus. These are bacteria which can cause pneumonia. Otherwise, common viruses like influenza viruses, AND, parainfluenza virus, adenovirus, rhinovirus, they all can cause pneumonia. There are also certain fungal causes of pneumonia, which is mainly seen in children who are immunocompromised. The immunocompromised, we mean children who have deficiencies in immunity, either due to primary causes or due to secondary causes of cancer. In that case, they have pneumonia due to candidate species, histoplasmosis, and these are like lesser common causes. But the more common thing which we see clinically everyday practice is bacteria like Streptococcus pneumoniae and viruses like influenza, parainfluenza, or adenovirus.
Thank you for your answer. My next question to you is, can pneumonia be prevented? If so, how?
Okay. The first thing to understand is, why does pneumonia happen? It happens mainly because of inhalations of aerosols which contain the organism, either bacteria or virus. Now, when you think of prevention, you need to think about, is it a prevention which is already a primary prevention, or is it secondary prevention? For primary prevention, we mean that we won't let the infection happen in your body in the first place. By secondary prevention, we mean is that if you have people around you having pneumonia, how can you actually prevent it from happening? So the first way of stopping pneumonia from happening is by getting a child or young adult vaccinated. So we have vaccines for Streptococcus pneumoniae, which we call as a pneumococcal vaccine, or we have vaccines for viruses, which are like influenza vaccines. Now, by talking to a pediatrician and getting your vaccines at the right time, you tend to develop immunity for the virus, for the bacteria, which prevents infection in the first place. And second, when you see that there is a lot of children having influenza or adults having influenza or other viral infections, you can actually also prevent yourself by taking medication, which would be told by your doctor. So this is a form of prevention which we call a presumptive treatment, when you treat it just before it occurs. But the most important way of preventing it is by having simple hygiene like washing your hands quite often, not touching places which probably is not appropriate to touch, like not touching dusty areas, not touching unsanitized places, less visits to hospitals to healthcare professionals if not very much necessary, and not crowding in places or avoiding overcrowded places. Yeah, and these simple sanitary measures can help you prevent.
Coming to my next question, what are the symptoms of pneumonia?
Okay. Now, symptoms of pneumonia can be, again, it could be systemic symptoms like symptoms which occur over the body, and also local symptoms like initially many of kids present with fever, with chills or without chills, They may have cough, they may have body pains, they may have tiredness, loss of appetite, they may have fever, most importantly. And there are certain systemic symptoms like they may have breathlessness, like when they start to breathe really fast or with distress. They may have uh, productive or non-productive cough. They may have breathing difficulty, as we discussed. They may have some may have colds and sneezing and general like unwellness. So these things all together tell you it could be pneumonia.
So, my next question is, how is pneumonia managed or treated?
Okay, so management pneumonia depends on how the infection is. Is it like severe or is it like light infection? The majority of kids we get these days in urban settings is someone with very mild or moderate pneumonia, which can be managed at home, thankfully. So I think the home remedy, the best thing to do is to visit your doctor to understand how bad or how severe your pneumonia is, if it is. And if your doctor confirms it is pneumonia, then I think most important thing is to get plenty of rest, a lot of fluids for the kids because we know that children may get dehydrated with high fever. So give them lots of fluids, keep them well hydrated, give them painkillers or give them fever medications as and how required. If you have cough, then try to understand the reason for the cough. If it's a cough due to bronchospasm, try and relieve the bronchospasm. If there's cough irritation, then you may use after supervision cough syrup, but then that's not the best thing. You don't propagate that. Uh, for more specific causes, if you find the bacterial cause, you can give antibiotics, both oral and intravenous. And again, if there's severe cases, if they require oxygenation, obviously in the oxygen, IV fluid, and obviously hospital support. So all these measures help together.
Coming to my last question, can pneumonia be treated using home remedies?
Okay, now this is very interesting because I don't know what exactly you mean by home remedies. So if infection, I mean pneumonia is due to a bacterial infection, then no, home remedies won't help you. You need to give specific antibiotics. Otherwise, the infection will go on multiply. Yeah, so if it's from viruses, because viruses have a fixed life, then obviously the infection will improve after some time. Home remedies help in that sense by giving you a bit of support during this time. And lots of fluids, a bit of warm touch, tender loving care. All of these make a lot of difference. Most importantly, I would like to underline here is the role of vaccination because vaccinations give you primary immunity to fight. And I think children should be vaccinated for pneumococcal infections and also influenza viruses. And obviously for coronavirus as well, if you are ready for it because coronavirus will also cause pneumonia, bad pneumonia. So yeah, get vaccinated. That's most important.
That
Okay.
would be all from my side. Thank you for your time.